again course under medicine and surgery where we'll be looking at the neurological assessment. I'm your host Morgan Epika Izurukama Jr. All right, so without let's just go into the introduction. So our introduction for today, we'll look at the so and in this unit, this is just the assess subunit refers to the activities that you need to carry out in order to make a diagnosis on a client who has neurological complaint. Okay, then to do this, we need to define the terminologies that are used to identify parts of the assessment that we need to consider when carrying out activities. Okay, let's start by defining what neurological assessment is all about. Definition. Neurological assessment is a method of obtaining specific data or other information in relation to the function of a patient's nervous system. It is typically performed by the attending physician. Okay, health history. Okay, so health history is very much important when you're assessing a patient that has um, neuro defect, or rather health history is very much important in neurological assessment. Okay, so an important aspect of neurological assessment in this history of the presenting of the present, the health history therefore includes onset when the situation started, associated with debilitating, aggravating, remission, and exacerbation or absence of similar symptom among the family members. Okay. Now let's look at the cranial nerves from your anatomy and physiology. Now remember, the cranial nerve from your anatomy and physiology. This one usually helps out to understand as well as to assess a patient having neurological undergoing a neurological assessment. Okay, so the first cranial nerve, it is called the olfactory. Yeah, even when your eyes are closed. Okay, then the second one, it is optic sensory vision. This one usually gives us the acuity as well as and the field vision, where the pupil usually um, reactivity to light and accommodation, that is the afferent impulse. Patient read the card one eye at a time. So you need to have a patient to read certain cards one eye at a time. So this one, we are just trying to assess the cranial nerve number two, that is the optic sensory vision. Then we also have what we call the test visual field by having a patient covered one eye. Then focus on the nose and identify the number of fingers, the motor eyelid. Okay, it's the motor eyelid. Usually averts the pupil size and the activity that is an efferent impulse. So you need to check your pupillary. So you need to check your pupillary response a bright light on one pupil. Okay, so you need to examine checking the pupil response, the pupillary response when by the virtue of using the shining of a bright light on one eye, on one pupil. Then both pupils should constrict consensual reflex. So they need to you need to examine for a consensual reflex, where you need to check that the pupils should construct. Do the same to the other eye and check for accommodation. Move your fingers toward the patient's nose, and then the pupil should constrict and converge. All right, okay. So this one, it's done when you are examining the oculomotor nerve, specifically for the eyesight as well as the pupil dilation and constriction. Then cranial nerve number four, it is the trochlea. The trochlea, nave, this one usually allows the turning of the eye downward and have patients look down and in. Then the fifth cranial nerve, it is called the trigeminal nerve. That usually allows us to both chew as well as the facial and the mouth sensation, cornea reflex sensory. Okay, so for this one, you need to ask a patient to hold the mouth open while you try to close it and move the jaw laterally against. Okay, then your hand, your against your hand, with the patient's eye, you need to close as well as you need to touch the face and have their identity and have identify the area. Okay, so the patient has to identify the area, and the area that you've touched in the comatose. Okay, so in comatose patients, okay, they usually have the brush. They brush the cornea with a wisp of a cloth. Then the patient should blink. They should blink, yes. Then cranial nerve number 6, this is the absent motor. This one usually allows the turning of laterally and have the patient move the eye from the side to side. Then cranial nerve number 7, it is the facial nerve. This one allows both facial expression as well as the test corneal reflex under the motor, that is through the eyelid and the lip closure. Okay, so in here, you need to ask your patient to smell the rice eyeball and keep your eye as well as the lips closed while you try to open them. Okay, so you need to have a patient identify the salty or rather sugar press. The patient has to identify the salt or the sugar that is pressed on the tongue. Cranial nerve number 8. This is the acoustic sensory. This one is responsible for hearing and equilibrium. To test the hearing, you need to use the tongue fork or rather the rub from your finger or the whisper near each ear. Okay. Then cranial nerve number 9. It is the gross pharyngeal nerve. The gross pharyngeal nerve, both ganging as well as the swallowing sensory and the test usually tap and assess articulation. Much for your attention.